Well, y'all, thank you for coming. Today we have with us as signers Leslie Klepak, assisted by Larissa Martin, and we're happy to have you here. Pastor, will you come forward, please?
Good afternoon. Leviticus 19:18 says, "Do not bear a grudge against anyone among your people, but love your neighbor as yourself." If you would, please pray with me. Gracious Lord, we thank you for this reminder to love one another, especially in times of turmoil and times of stress and anxiety. So Lord, as we continue to move forward through this time, I just pray that you help us to continue to do that, continue to love one another, continue to reach out to one another, and continue to keep each other's best interests in mind. And I ask all this in your mighty and precious name, Lord. Amen.
Thank you very much. Thank you for coming again today. This is a part of our effort to keep the people, you and the people through you, the people of the state, informed of what is happening in our state concerning the coronavirus and other things as well. The first thing I'd like to say to everybody out there listening, particularly to young people, is this is a dangerous, deadly disease. You've got to follow the rules. Wear your mask. Keep that distance from people. Wash your hands. Be careful. If you're sick, go home. If you have any doubt about whether you may have the virus, go get a test. But for goodness sakes, wear your mask. Keep that distance. And we know that the young people can have this disease and not know it. And they feel completely healthy, yet they are completely infected. And they can easily pass that to the older people, so young people. And that's anybody from 40 on down especially, but particularly those 35 or 30. The rates of infection among those young people who are now, younger people who are now getting tested is just going up, up, up. But they are showing no symptoms. And we're hearing stories of groups coming back from the beach where just about everybody that was in the group is infected, the young people, and they can pass that, as we know, by coughing and sneezing, but also just breathing at close contact with other people, and particularly the older people might die from the thing. So, ladies and gentlemen, we got to follow the rules. We've got to follow the rules, and we've made progress in reopening. Reopening our state is highly important. We've got to do it. People cannot live without work, without the income, but there are a number of institutions, a number of activities that we have not yet lifted the restrictions on, and I'm going to issue a new declaration of state of emergency, and we have no plans to lift restrictions on these highly active groups and activities until we see that infection rate go down. And that is on nightclubs, on concert venues, on theaters, auditoriums, performing arts centers, spectator sports, and that's minor league baseball, racing, all of those things that involve crowds. And most of these things involve young people. And we know from our experience recently that's where the virus is really taking hold. And we know that the young people travel. The younger people travel, and they have contact with the older people, and that's when we get into deadly trouble. So I want to say in the strongest, most urgent terms, keep that social distance. Keep that distance, particularly if it's your parents, your grandparents, or anyone older than you are. Be very, very careful. Keep that distance. Wear that mask. Wash your hands. And be considerate. That is important. It is deadly important that we do that. So we are opening. We've been reopening. As you know, we did not close as much as other states did. We're still seeing progress in the reopening according to the guidelines from Accelerate SC. It was a great group with great guidelines, and they're very good. I've directed DHEC to develop a plan for nursing homes and assisted living facilities to allow limited visitation, but for immediate family members only. Not just wide open visitation. Again, particularly younger people, you're not going to be going in there. we're going to have to be very careful because those people in those facilities are highly susceptible. The reason they're there indicates that they're highly susceptible to this contagious, highly contagious disease. But we do know, and we've known from the beginning, and the predictions are coming true, that not having loved ones making those visits, not having people going into the nursing homes, of course, has reduced the spread, we believe, but it has also increased the feeling of isolation, the mental, emotional strain, and other problems. The isolation does that. The domestic violence, the alcoholism. I haven't seen the suicide rates lately, but all of this kind of isolation does cause those sorts of unintended consequences. But we are going to develop a plan to allow loved ones to see their loved ones in these nursing homes. But again, we've got to be very, very careful. Hospital capacity. Our hospital capacity surge, all of you have attended these meetings, have heard about it from the very beginning. General McCarty is here to provide details, and also Marshall Taylor of DHEC and Dr. Duvey. But our hospital capacity surge plan is still activated. It's available, and it is ready to be deployed the moment it is necessary. We've had conversations with the hospitals all through this. At my request, they reduced their elective surgeries. The occupancy rates went way down. Since then, they have started having those elective surgeries, and that's good because people are getting treated, but also we need to be sure that we have plenty of space in case the rates continue to rise at the rate that they're going up. And I want to assure the people of the state that we're ready for it. We've been ready for it, and we'll discuss that in a little more detail in a minute. And I may have to require elective surgeries to be postponed again. Restaurants. Please participate in the Palmetto Priority program that we announced just recently that was developed by the Restaurant and Lodging Association along with DHEC and Parks, Recreation, and Tourism. You can go to acceleratesc.com, and you can see what you need to do. There's several cities have similar plans. The city of Greenville, I think, was the first one that came up with a very good idea. Others are being modeled on that. But the Palmetto Priority Program, it provides a sticker to be displayed for those restaurants that have agreed to and are following all of the requirements that DHEC has instituted and recommended, and they receive that, essentially the good housekeeping seal of approval, as long as they keep doing what they're supposed to be doing. So we ask the restaurants, if you have not yet applied to do that, or you're not participating in one of the city plans, do so. Again, wear your mask, keep that distance, be careful around older people. We cannot mandate. It is ineffective. It is impractical to have a mandate that everyone wear a mask, because it is not enforceable. And for me to tell you that we are going to require people to wear a mask and then not be able to enforce it gives a false sense of security to those who believe that everybody is following the rules. Now, the cities do have some authority. It must be strictly limited, must be according to law, but they do have authority. Every city is different. Every businesses in those cities are different. Circumstances, the clientele, the people, and if they want to impose a reasonable legal limitation, then there's no obstacle to that. But enforcement is the problem, and enforcement is the challenge. And to provide, as some states have done, they say that face mask and other things are mandatory, but they announce they're not going to enforce it and they don't have any penalties for it, is, I believe, is making a misperception and a false sense of security to the people. So I'll tell you what we're doing in South Carolina is we are telling you in the strongest, most urgent terms, follow these rules, wear those masks, and if you're outside riding on a tractor plow in a field, you probably don't need to wear a mask. And that's not required or recommended by DHEC or the CDC or anyone else. But you know when you need to wear it, and when you need to wear it, put it on. Again, I mentioned earlier about not lifting restrictions. We're not going to consider lifting those restrictions where they are still in place until this infection rate starts going down. Finally, school districts, parents, we are intending to open schools as been announced earlier in August. We intend to do that. The districts are working. The school districts are continuing to prepare for in-person instruction in the fall. It's not now time to make any decision about doing anything else. We want that infection rate to go down, but parents, we are intending to open the schools as we have announced earlier, unless we announce earlier at some later date. But I am confident that if people follow the rules, if they use that distancing, they keep that distance from those who may be infected, if they wear the mask, if they wash their hands, if the people are careful and courteous, then we'll be able to go ahead with these plans that we've made all over the state with very little interruption. So I thank you for being here today. We'll answer more questions at the end, but this time I'd like to call on Dr. Duvey of DHEC. Please do.
Thank you, Governor. Oh, this is going to snap off. So today, we are announcing the second highest number of confirmed cases of COVID-19 in a single day at 1,273, and one additional confirmed death. This is only a few cases shy of the nearly 1,300 confirmed cases we announced on Tuesday. This means that South Carolina has exceeded 30,000 confirmed cases of COVID-19 in our state. Our total number of individuals who have tested positive for this deadly virus is now 30,263, and we have lost 694 South Carolinians to COVID-19. Today, we have the highest number of individuals who are currently hospitalized because of complications from COVID-19, and that number is 906. South Carolina is making national and international headlines, but not in the way we'd like. Our state's numbers have drastically increased over the past few weeks, making us now one of the hot spots in the country for COVID-19. The governors of 6 states, including New York, have announced that anyone traveling to their states from South Carolina will have to automatically quarantine for 14 days. When I arrived here at the beginning of April, it was just the opposite. New York, which was once our country's epicenter for COVID-19, is now having to quarantine South Carolinians who come. One of the more alarming trends in South Carolina is the number of young people, as the governor said, who are testing positive for the virus. Since April 4th, South Carolina has seen a 414% increase in newly reported cases among the 21 to 30 age group, and a 966% increase in newly reported COVID-19 cases among those between the ages of 11 and 20. We are aware of clusters of cases among teenagers and young adults who have spent time together in social settings, including parties and trips to our beautiful beaches. They didn't wear masks, and they didn't social distance, and many of them contracted the virus, which not only caused them to be sick, but put the health of their families and their entire communities at risk. We know that you're tired of hearing it, and we are tired of saying it, but we'll continue to say it until more people heed our recommendations. Wear a mask, social distance from others by at least 6 feet, avoid group gatherings, wash your hands, and stay home when you're sick. We don't have a vaccine yet for this virus. There is no cure. There are only our individual actions that help us take care of one another. And as we heard the chaplain say, our duty from a higher authority is that we love one another and we care for one another. Please wear your masks.
Thank you, Dr. Duvey. Major General Van McCarty, the Adjutant General. Please.
Thank you, Governor. Back in April, the governor directed that we help support development of a hospital surge plan. In working with the Department of Health and Environmental Control, working with other state agencies, with federal partners, and with, most importantly, the hospitals around the state, we began to develop that plan. That plan was developed. We put into place contracts with logistical companies to help provide the necessary support elements to put in place. We have developed contracts with both public and private facilities that could be used to house hospital patients if we needed to. The plan all along was intended to take patients that were less acute in terms of their medical needs, move them outside of the footprint of the primary hospitals, leaving those beds in the hospital for more serious patients, to include COVID patients. In doing so, what we saw as probably one of our greatest advantages was the work that the hospitals were able to do at the direction as identified by the governor to decrease the amount of elective surgeries. They were able to lower their census or their hospital daily bed usage. Since then, they have increased that capacity, but through daily contact with our hospitals and with the appropriate entities that work in that arena, they are monitoring that, and they are prepared as necessary to reduce that census or bed count by reducing elective surgery as necessary. We are also prepared to implement that plan that we have developed. It has been refined. We're ready to be able to do so. We actually put it into place in concert with MUSC. We set up a facility. It was since taken down because there was no need to have it up and ready to be occupied, but we did it to ensure that we had the know-how and we understood what it would take to put these facilities into place, and we're prepared to do so if the situation does require. But the plan all along was intended to be tailorable and scalable to our needs, with the primary goal of working with the hospitals to increase their bed capacity by moving out those less serious patients as necessary, and that's what we're still prepared and ready to do if needed. Thank you.
Thank you, General. Does anyone have any questions? And Marshall Taylor is here from DHEC, as well as Kim Stinson from Emergency Management Division.
So
Yes,
you
ma'am.
said repeatedly follow the rules. Part of the problem that folks are wanting a statewide mandate is because the rules are differing from city to city. Should there be at least some sort of guide of what to require?
Yes, there is a guide. It's the CDC guidance and also DHEC guidance. It's virtually impossible to fashion a statewide rule that applies to different kind of restaurants, different kind of facilities, different kind of clientele, different kind of weather all over the state. If a city wants to do something that is specifically tailored for them, they have the authority to do that, but they must be careful to be legal and don't go into an unconstitutional area. But these mandates are in the end are unenforceable. Most of the cities, I know the city of Columbia is going to be, I think they said that the parking attendants and other city employees would be doing the enforcing, but not the police. That indicates that we don't have enough, we don't have an enforcement mechanism of this nature to cover the entire state. When we have hurricanes, and when we were earlier on, when we were getting the people off the beaches and off the islands in the rivers, down at the river, we barely had enough people to do that, and we had everyone activated from the Department of Natural Resources and SLED and the local authorities and the sheriffs and everybody involved. That was a Herculean task, and we just barely accomplished it because we had the enforcement mechanism there, and it was a criminal penalty. But to announce that we're having a mandatory requirement for people that is in the end is unenforceable is not the right policy of government. What government should do is tell people what they need to do, inform them. That's what we're doing. Now, if the cities have the mechanism to enforce it in their particular area, then that is certainly up to them. That's within their right. But a statewide mandate is not the right way to do it. The better way, and the way that we're doing it, is one that is within the law and that we know will work if people will only take advantage of it and follow the advice and recommendation of the health authorities.
You said that cities need to take care not to go into basically cross a line to being unconstitutional. What is that line?
It's too broad. Without going into it in too much detail, the people have rights and liberties of association, of speech, of religion, all those things that you know, and there's a property right as well. And you can't close a business unnecessarily for too long a period unless you have a very good reason. It's got to be tailored to that and last only so long as absolutely necessary. And ultimately, at the end, you have to be able to prove it in court that you did the right thing. Well, if an ordinance is too broad, then it is automatically has gone over the line. It must be very carefully tailored, directed to a known problem, and be an effective measure to counteract that problem. It's really a legal question. Most people don't think about it in those terms, but it's when people bring lawsuits on having been restrained in their liberties and having lost their livelihood for various reasons, then it becomes a very serious thing. Was this government rule one that was too strong, that was over the top, and that took their property and their rights away from them?
Governor, you've talked a lot about the beaches, young people at the beaches. Myrtle Beach is getting a lot of attention and some blame. July 4th is next weekend. Are you considering closing the beaches again to try to get this under control?
No, I'm not. The local authorities have the authority to respond to those kind of things, and as mentioned by Dr. Duvey with the New York, New Jersey, Connecticut, and I think those were the ones that have developed a formula for if an infection rate in a certain state gets to a certain level, then those people will be quarantined. Well, we're one of, I think, about 10 or 12 states that have fallen into that category. And of course, we had done the same thing earlier when New York, New Jersey, Connecticut, and the city of New Orleans was spiking high, so high that the CDC, the Centers for Disease Control, issued a domestic travel advisory and told those people to stay in those states and don't go anywhere. That was at the time where we put a limit on people coming here from those areas. We didn't bar them from coming, but they came, they had to be isolated for the 2 weeks, and we disallowed the rental of hotel spaces and things of that nature. But this is the kind of thing that's going on in the country, because places are spiking all over the country. And my bet is if you were to go look at the places that's spiking, you would find that people are not keeping that distance. You'll find that they're not staying clean, they're not taking care, they're not wearing masks, they're not doing any or all of the things that they've been advised to do. So the best thing for us to do is understand we have a deadly disease on our hands. It's becoming more and more clear how deadly it is. We're learning, doctors and others can know more about this than I certainly do, but we're discovering that it's affecting your organs and all sorts of things, not just your lungs. But we know that it can be spread now. We thought at the very beginning it's just with the droplets from sneezing and coughing, and now we know just talking and singing like I'm doing right now. Not singing, but talking, just kind of talking and choir, singing in choirs. We know that is a fertile area for the spread. We know more now than we did. We know what to do to stop it, but it's up to the individual. There's no way we can make somebody do something that they just don't want to do. But as citizens of this state, if we all understand that that's what we must do, and we remind each other of that, then we'll begin to make some real progress. Yes, sir.
The governors, or not the governors, but the states of Texas and Florida effectively shut down bars with banning alcohol sales. Any thoughts to do that here?
No, we're not going to do that. We're not going to do that. Yes.
Nursing homes, can you be more specific? Are you going to set like an age limit of who can come in there, and when might that happen?
Well, those are the kind of things that DHEC is considering. We have more information than we had before. We know more, and we're smarter now than we were 3 months ago. Marshall Taylor?
Yes, sir. Thank you, Governor. First of all, we recognize the pain that not being able to see your relatives in nursing homes and other long-term care facilities causes. We, at DHEC, I hear on a daily basis about people who haven't seen their parents in months. And so we understand that. This is kind of going to be a phased approach. We started with guidance that allowed contact across a window, a glass door, that type of contact. Next week, we intend to issue guidance that will allow outdoor visitations. And the details of that is still being worked out. And then hopefully, eventually, we'll have in-facility down the road as case counts go down, in-facility visitation. But look for more next week in that regard.
While you're up, do we suspect that there's any increase in abuse and neglect because people have not been able to see their relatives?
So one of our primary ways of finding out about abuse and neglect, just like the governor mentioned, is through complaints from family members. That is probably the primary way we find out about those things. We are still conducting what we call immediate jeopardy complaint investigations, so we do still get complaints. So we do still go into the facilities, and also we are going into facilities using CMS guidance to do infection control inspections. So we are still in the facilities looking for concerns, but we definitely need the public to also be providing those complaints.
And to echo that, I'm highly concerned about it because it's the public, the family access to the nursing homes has helped not only to, it helps those in the nursing homes as well. It's not just to check on the employees of the nursing home, but it's to check on the parents and the elderly people that are there. And because sometimes the family members will see something that others don't see. So it's healthy all around. I'm very concerned about it. I'm concerned about the mental health, the emotional health that have been hurt by the people in our state because of the isolation and all these. Those are the unintended consequences of shutting things down and requiring isolation. But we've gotten to the point now where we know what we do. We don't need to shut things down. You have mental health. Part of public health is mental health. Part is emotional health. Part is economic health. Part is all of those things combined. It's more than just one thing. If we could go to the epidemiological extreme, we would close everything down and have everyone stay inside and everyone wear masks. But the country would fall apart. We cannot do that. But we can't do it. But at this point, having gone through what we've gone, we know what to do. Shutting things down is not the answer. We did that. We learned how the disease spreads. We were able to, at that point, to control things, learn how to combat it, learn how to accommodate it. We know that. And now is the time to use those lessons that we learned, and that includes following the advice that we've gotten all along from the health authorities. Yes, sir.
This is for the doctors at Doobie. Can you talk about, for people who have gone to the beach since Memorial Day, would you recommend they go get tested?
Yes. If you've gone to the beach, you've likely come in contact with somebody who is positive but perhaps asymptomatic. We know that infection rates from groups that have gone to the beach are very high, sometimes including everyone in the entire group. So if you've been to the beach, especially on a school trip, or participated in group activities, not worn your mask, not socially distanced, it would be a good idea to find a pop-up testing site and go and get tested, and that's at no charge.
Governor, do you
And I think we have, how many testing sites are open today?
11 today,
Yep.
the pop-up testing
That's
sites.
the pop-up testing.
And then the regular testing sites, I'm going to get the number wrong, but it's on our website. It's 100 and some regular testing sites
I
open.
think it's 150,
50 or, yeah,
170
something
or
like
something
that.
like that.
Yeah.
While you're up there, how do we count hospitalizations? Are they counted because they are sick with COVID, or perhaps because they've tested positive or they're in there for something else and test positive for COVID?
So the hospitalizations are confirmed, that we report are confirmed of patients that are confirmed with COVID. That means they've had a positive test. They could be there for a number of reasons, but if you have a positive COVID test and you're in the hospital, that's a confirmed COVID, a patient with COVID. Most likely, those patients got admitted to the hospital because they were symptomatic with symptoms of COVID.
And know who's best to answer it between you three, but with the hospital surge plan, is there a benchmark in hospital capacity you're going to see if you meet, God forbid, and then have to begin the surge plan?
Yes, Jim?
Yes, right now, what the hospitals are looking at is an 80% capacity benchmark. And right now, statewide, we're at about 75%. And again, as we discussed earlier, there are mechanisms internally that the hospitals can and would do to reduce the amount of current usage, and that would be by maybe reducing elective surgery. So we will look at those type of mechanisms first to see how we can manage the hospital utilization need. Our priority and our preference would be to keep patients in a traditional hospital. So we would look to use the alternative facilities that we've talked about as only a second measure once we determine that that is there. But right now, again, that benchmark that hospitals are using is acceptable at 80%.
And I'd like to add, the hospitals have been most cooperative and communicative throughout this from the very beginning. We've had great cooperation.
Governor, despite not issuing the order statewide, do you think it's the right move for cities like Columbia to issue the mask order?
That's up to them. Depends on the circumstances as they see them. No two cities are alike, but of course you still have the question of enforcement that needs to be answered.
We've heard some hospitals are already at 90% capacity, particularly LexMed and some places in Kershaw. So are y'all talking to hospitals kind of individually about what they need to do, or is it statewide 80%? Can you clarify?
The 80% I'm speaking of is a state average. As we discussed earlier, and I think at one of our previous press conferences and when we had the medical personnel here, our hospitals in the state routinely have to move patients around. We see that primarily in hurricane-type situations where hospitals that are on the coastal plain may be impacted, or there's a threat of them being impacted. So they routinely move patients, and we see that on a day-to-day basis for other reasons. Your local county hospitals only will have a certain capacity for ICU beds. As that situation dictates, they will move patients to a larger municipal hospital. So that type of practice is always in play, and they would look initially to cross-level that level or that need across the existing hospital plane, and that 80% is a statewide versus an individual. And I understand, I'm tracking, there are some facilities that are above that, but that is a statewide average. Yes, sir.
Governor, can a business refuse to admit someone if they don't wear a mask?
I beg your pardon?
Can a business refuse to let somebody come in their store if that person who wants to come in refuses to wear a mask?
John, look, that's a good legal question right there.
It's just a question, Governor.
Yes, it's a legal question. It requires a little bit of research.
Well, I have
but
another.
those are the kind of questions that come up with mandates.
Here's
Yes,
another question. In the early 2000s, I covered the years-long debate over mandatory seat belts in the General Assembly. We heard the kind of things against mandatory seatbelt law that you're saying now. It'll be too hard to enforce. It's a matter of rights. People know what to do. People know what to do. All these things that you say. Now, people were dying needlessly because once the mandatory seatbelt law was passed, the compliance rate for people wearing seatbelts in South Carolina went from 55% to 95%, and every year, hundreds of fewer people died. We have another life and death matter. You have it in your power to issue some kind of mandate requiring people to wear masks, especially young people. You're a father like me, you know young people don't obey their parents. Why, if you can save lives, don't you issue some kind of mandate?
Mr. Monk, two major differences that I can think of immediately. One is that there was enforceability on the seatbelt laws. And number two, when the manufacturers started putting the whistles and the bells, and sometimes the vehicles wouldn't turn on until you put your seatbelt in, that made it very easy to remember to put your seatbelt on. Every situation is not like the next situation, as you understand. Are there any further questions?
Yeah, so as you know, the AG released his opinion on the Heritage Act. What did you think of that opinion, and what do you suggest maybe they do next session?
What do I suggest that the AG do next session? Or
The legislators do. Should they take up renaming Tillman Hall?
Well, that'll be up to the legislature. I've not studied the opinion. I read it. I have not read the statement that went along with it. But the essence of it was that the law itself that prohibits the moving, destruction, renaming of a variety of different things under different circumstances is constitutional, but the two-thirds vote required to have a particular amendment or amendment made for a monument or a street name or something like that is a two-thirds vote in each house. That is the question that I think the Attorney General answered. It's one that was raised at the time that the Heritage Act was passed, and that is whether one legislative group, one session, can bind the next. And Solicitor General Cook and Attorney General Wilson said they believe the answer to that is no. But although the act itself is severable from that clause, if that clause is found to be unconstitutional. But that will have to either be addressed and changed by the legislature or addressed and stricken by a court. And until that time, every law is presumed to be constitutional and should be enforced.
Governor, one more. You have almost 700 dead South Carolinians due to COVID-19. To the people not wearing masks and refusing to wear masks, do you think they have a hand in the number of deaths we're seeing?
I wouldn't put it that way. I would just say that we have learned over the months, watching not only what's happening in our state to people we know, but to people we don't know all over the country and all over the world. And we know this disease is a killer. We probably don't know all that it's doing to our bodies now, because we seem to learn more as we go along. But we know, or we think we know, how to prevent it. And that's by following these very simple rules. And there's no power on earth that can follow everyone in the state around to be sure that they are following the rules. That is up to the individual. So I would encourage every individual, take it upon yourself to follow those rules. Stay away, particularly if you're a younger person and there's an older person in the categories we described. Keep that distance. Don't take that chance. If you go get closer, wear that mask. Wear the mask at the opportunities that have been so well described by everyone for so many months. Wash your hands. When I leave here, I'm gonna go and wash my hands, of course. You have to be careful, but it's up to every individual. There's no power that can make people do something if they don't want to do it or they don't believe that they need to do it.
Governor,
Yes.
what's the next step if people continue not to comply with your recommendations that they wear masks and social distance?
What's the next step?
What's your next
Is
step?
until a vaccine comes along, the rate's going to continue to go up. More people are going to die. More people are going to be sick. And more people are going to be sorry and crying about
What is
it.
your plan if that continues?
The plan is what I have described, is we've got to use our heads. We've got to be smart. We've got to follow the rules. We have plenty of instruction, plenty of information. I say, ladies and gentlemen, please follow the rules, follow the advice, be courteous, and we'll get through this.
Thank you, everyone.